Good evening, everyone. My name is Suzanne Seplow. I'm Assistant Vice Chancellor for Student Development and Health and Academic Partnerships and Student Affairs. And I appreciate everyone being here tonight and for this town hall meeting with our students. We have a number of panelists with us to hopefully answer many of the questions that you submitted prior to the event tonight. And so our goal is to be able to answer questions and provide updates to you all about what's currently happening, our summer and fall planning for this upcoming summer, as well as the upcoming fall. And we will do our best to answer as many questions as we can. There will be a Q&A feature that is open, and you could continue to submit questions if you were not able to submit questions ahead of time. We'll do our best to answer as many as possible, but we'll follow up with some FAQs for our students following the presentation to be able to answer the questions that you continue to have. So without further ado, I'm going to invite John Ballard, our co-interim executive director of the Student Health and Wellness Center, the Ashe Student Health and Wellness Center, to kick us off tonight. Welcome, John. Thanks for being here and for giving us some information about COVID-19 protocols and what's happening.
Thank you very much, Dr. Seplow, and thank you all for joining us this evening. I've been asked to speak briefly about the state of COVID in Los Angeles County and on campus here at UCLA, and then to talk briefly about the new vaccine mandate, as well as what's going on with testing. If we can bring up the slideshow, thank you. Next slide, please. So the good news is things are going really well in LA County right now. This represents on the left, the daily number of deaths due to COVID, and on the right, the positivity rate, which is of all those who test, the percent who test positive. You can see how dramatic these lines are. This is great news. In fact, there are less than 10 deaths per day right now due to COVID in Los Angeles County. At one point, there were well over 250 deaths per day. Similarly, the 7-day average for the positivity rate is below 1%. Also excellent. In a relatively short amount of time, we've gotten to a point with a very low positivity in LA County. Next slide, please. This chart shows you the difference between the comparison of UCLA in blue, of LA County in the red line, and California in gold. And you can see that although there have been some pretty dramatic surges in late December and January in the state and in the county, UCLA has been really fortunate to keep our positivity rate very low. And that's in large part due to your diligence. We're very grateful for your participation in our testing program, and also for wearing your face coverings, keeping appropriate distancing, all of the things that we all know too well by now. Next slide, please. This slide shows new COVID cases by day at UCLA. The blue are staff and faculty cases, and the gold is students. This goes back to January, and you'll recall in January we had a huge surge of COVID in the country, in LA, at UCLA. One day we had 134 people test positive on campus. Things then calmed down, as they did with many parts of the county. And then you'll see on the right-hand side that we had a little bit of an uptick there. That was unfortunately post spring break travel and post March Madness celebrations. So we did go up to mid 30 cases in one day, but we are back down now. And I'm really happy to report that last week we had a total of 8 cases on all of the campus. That's still 8 too many, but it's the first time we've had no faculty and staff cases since we really started robust testing. And it is significantly lower than we've had in prior weeks. So great job, everybody, on that. Next slide, please. This just shows our total number of COVID cases on campus since we started tracking this back in March of last year. And you'll see 2,630 cases. Of that, about 70% are students, 30% are faculty and staff. Again, because of our low positivity rate, although 2,600 is a high number of people to have had COVID, it's a relatively small number given our overall population. Next slide, please. I want to just speak briefly about what's going on with testing on campus. We have now done more than 300,000 COVID tests on campus. Most people are now testing weekly. We just went through this patch of twice weekly testing because of what was going on with COVID on campus, but we're back now to once per week. And we're strongly encouraging the people who are not required to test. We're encouraging you to test as often as you can. If it's convenient, come to campus and test with us. Importantly, it's important to say that even vaccinated people still need to test on campus. We are going to get to a point where being vaccinated means you do not need to test any longer, but we're not there yet. And I'll talk a little bit more about vaccination in just a minute. I also want to highlight for you what's going to happen with testing over the summer. We're going to switch from our 3-location testing protocol. We're going to go to a completely self-contained kit that will be distributed via vending machines on campus. It'll be very easy and convenient for everybody to test. It'll be a saliva-based test, which will be a little bit easier than the nasal swab we've been doing, and you'll still get your results in 24 hours. You can expect a lot more communication on that as we get ready to make that change. Next slide, please. Many of you have probably heard about the proposed vaccine mandate, and I know from seeing questions ahead of time, there are a lot of questions around this, so I'm going to spend just a minute on it. The proposed policy, which is in a 30-day comment period right now, is that all students and employees living, learning, or working on campus or in campus-owned facilities will need to either provide proof of vaccination for COVID-19 or apply for and receive an exemption based either on medical conditions or on religious and personal beliefs. This is really important to emphasize that although everybody will be required to follow the mandate, you may request and be given an exemption for strongly held religious beliefs or medical reasons. Also, this vaccine mandate will only go into effect when at least one of the vaccines receives full FDA authorization. We are very hopeful that that will happen before the fall, but it has not happened yet. And the vaccine mandate will not go into effect as long as the vaccines are just under an emergency use authorization status. Likely, the way that we think this is going to work is that you'll be required to be fully vaccinated at least 2 weeks prior to the start of fall quarter. Those unable to be vaccinated, either because you don't have access to a vaccine, that would really be the only reason, I guess. If you are not able to be vaccinated and you arrive unvaccinated, we will vaccinate you. But we want to really emphasize, do not wait to get vaccinated. Go get vaccinated now. There are all kinds of options for getting vaccinated. Go get vaccinated now. You can already upload your vaccine information to the Ashe portal. Go to our website listed there. and you can start uploading your vaccine card there. It's really important that you not wait until you get to campus. If you do, we will be able to give you a vaccine, but you may have to sequester for a period of time. You'd like to have to continue to test for a period of time. It'll be much less convenient if you get the vaccine when you arrive here on campus. Finally, a quick word about international vaccines. Right now, the feeling is that they will be accepted as meeting the vaccine requirement. The FDA does not have any oversight of international vaccines, so you won't be able to get, likely will not be able to get an FDA approved vaccine internationally, unless it's one of the 3 that have been approved in the States. But you should still get vaccinated if you have access to a vaccine internationally. It's likely that those will be accepted, and there'll be more information coming out on that soon. The last thing I'll say on this is we sent out about 40,000 secure messages to UCLA students, all current and incoming students that we know about, incoming students, to explain how you go about getting a vaccine at the UCLA health system. Please check that secure message if you haven't already, if you're interested in getting vaccinated at the UCLA health system. We are now starting to see the gates open a little bit, and vaccine is much more available. So you can go to myturn.california.ca.gov and look there for vaccine opportunities throughout the state. You can also look at that secure message for detailed explanations of how to get vaccinated here at UCLA. Next slide, please. Look, our goal is community immunity. As a UCLA community, the more of us that are vaccinated, the better. That makes it safe for all of us, especially for those who, for medical reasons or for deeply held religious beliefs, cannot get vaccinated. Having a herd immunity, this community immunity, allows one sick person to be dropped into the middle of that herd immunity and not spread the disease. So I can't emphasize enough. It should be obvious by now how pro-vaccine I am. Please, please take every advantage you can and get vaccinated right away. Thank you so much.
Thank you, John. Very helpful information, and answered many of the questions that were provided pre this town hall. So really appreciate that. Next, we're going to move to Dr. Edith Flores. Dr. Flores is one of our primary care physicians at the Ashe Center and is going to share with us some additional information as it relates to vaccines. Dr. Flores, thank you.
Hi. Today, I don't see the slides. There we go. Okay, so I'll be talking about vaccines that are authorized for use in the United States. Next slide, please. First, I want to say, as been mentioned before, that the vaccines that we have in the United States are not FDA approved. They have been granted emergency use authorization, which is granted during a declared emergency, for example, pandemic. The risks and benefits must outweigh the potential benefits have to outweigh the known and potential risks for a vaccine to get emergency use authorization. And the COVID-19 vaccine candidates have to reduce infection by 50%. And all of the vaccines currently available surpass that standard. And finally, all these vaccines must meet the same safety criteria as any other vaccine. Next slide, please. As everyone probably knows by now, there are 3 vaccines available in the United States: Moderna, Pfizer, and Johnson & Johnson. Pfizer and Moderna are messenger RNA vaccines, and the Johnson & Johnson uses a viral vector technique. They're basically all for adults, except for the Pfizer vaccine, which can be used for people 16 and up. They are not interchangeable at this time. Next slide. So how do these vaccines work? And in particular, we'll start off with the Johnson & Johnson viral vector vaccine. All vaccines work by exposing the body to some or all parts of the virus. The coronavirus uses the spike protein, the little doohickeys that you see, the red ones on the left. They use that to enter the cell, make copies of itself, and cause disease. That spike protein is what the vaccines are using to show the immune system to get a response. The vaccine for Johnson & Johnson uses an adenovirus that's been stripped of its ability to cause disease. And then the genetic instructions or the recipe or the blueprint for the spike protein is then incorporated into that adenovirus. And then when the virus enters the cell, it cannot reproduce itself. All it could do is instruct the body to make spike protein. The body makes the spike protein, the immune system recognizes as something that is foreign, and an immune response is generated. So that if you are exposed to coronavirus, the body can respond immediately and try to neutralize the threat. Next slide, please. And the messenger RNA says, why do all that work? Let's just inject the blueprint for the spike protein directly into the cells, have the cells make the spike protein, and then have the immune system respond. And that's exactly how this one works. This is one reason why this was so much, so it's easier to make because you don't have to play around with viruses in a lab. You simply use the genetic material. Next slide, please. So the efficacy of these vaccines, Johnson & Johnson has a 93% reduced risk of hospitalization. It has a 72% reduced risk of mild to moderate disease in the US. Globally, that's a little bit less. It's more like 66%. The messenger RNA vaccines have 94 to 95% reduced risk of symptomatic disease. Next slide, please. Side effects of the available vaccines, they're all what we say reactogenic, and that means that you can get some flu-type symptoms with it. Pain at the site of injection is the most common, with close to 90% of people experiencing that. Other people can feel flu-like symptoms. The flu-like symptoms are more common with your messenger RNA vaccines, especially after the second dose. It's more common in younger people, and it's more common in people who have already experienced the COVID-19 infection. And side effects are not a sign of disease, they're a sign of an immune response. And so even though it's bad, it's good. Next slide, please. So rarer side effects. When Pfizer, the first messenger RNA vaccine that came out, on day 1 or day 2, the headlines exploded. Severe allergic reactions with these vaccines. And that's true, although they are rare. That side effect is primarily seen with the messenger RNA vaccines. However, it is okay to receive these vaccines if you have allergies to medications, environment, eggs, latex, animals, or a family history of allergies. Now it's Johnson's turn for its 15 minutes of fame. So with what's called thrombosis with thrombocytopenia syndrome, and basically thrombosis means clot, thrombocytopenia means low platelets, and platelets are a part of the blood that's responsible for clotting. What's unusual here is that you're getting these clots in unusual sites, the brain and the gut. And this is very serious side effect, but they are rare. And next slide, please. And because of that, the FDA and CDC, as you probably know, paused the vaccination because of this. There have been 15 cases of this out of 8 million Johnson & Johnson vaccines. All of these cases have been in women between the ages of 18 and 59, and the symptom onset was essentially 1 to 2 weeks after vaccination. So the rate of this disease is 2 to 7 per million. In contrast, the COVID death rate is 116 per million. So the CDC and the FDA concluded that the benefits greatly outweigh the risks. And so the pause was lifted. Next slide, please. So when can we lose the mask? Not yet. So can asymptomatic vaccinated individuals transmit infection? The answer is maybe not. There's a growing body of evidence that these vaccines decrease your risk of asymptomatic disease that can then be passed on. And the monkey wrench here is variants. Are variants chipping away at the efficacy of our vaccines? Possibly. This is why it's very important for people to be, as many people to be vaccinated as possible. When will we reach herd immunity? Not yet. We have to be at least somewhere between 70 and 85%, and that's sort of been a bit of a moving target. And finally, how long will the vaccine immunity last? don't know yet, although it seems possible that you may need at least a booster and possibly an annual vaccine. Thank you. That's it.
Thank you, Dr. Flores. Critical information to know and understand as it relates to our vaccines. I'm going to ask maybe John to come back onto camera for a second as well. And there is, just to keep this flowing, and if you need Dr. Flores, we can pull her back too. But a question that continues to be asked, and that is as it relates to what will students need to do, or what will be the process in terms of an exemption for either medical or religious purposes for the vaccine. So if you could add a little bit to that, and then we will go next to our next two presenters. Thank you.
Sure, I'm happy to. So what you will find as you go into the portal on our website is it'll give you the information to request an exemption. We're not quite there yet with the religious exemption because that policy has not been approved, but there is a medical exemption each year for the immunization requirement. And that's something you really want to talk with your physician about. There are contraindications that are put out by the manufacturer. Having a conversation with your own physician who knows your health is the best way to see whether you qualify for a medical exemption. A religious belief or personal belief exemption is based on a deeply held religious or personal belief. And there will be a form also there that will allow you to submit that request. They'll both go up through Ashe and we'll communicate back to you as those are approved. I will say that if you get an exemption, it's likely for either medical or religious personal belief, it's likely that you will have ongoing NPI requirements, non-pharmaceutical intervention requirements, like regular testing, like continuous mask wearing. All of those kinds of things will be in place for those who do receive the exemptions, but you'll find the information on our website. Thank you.
Thank you, John, so much for filling in that question that was asked a number of times. Next, a number of questions that have come up and come forward is in regards to our academics for both summer and fall planning. And so we're really pleased and appreciative to have Dr. Megan McAvoy, who is the Undergraduate Council Chair, as well as Dr. Susan Ettner, who is our Interim Dean for Graduate Education, join us today to share a little bit about our academics and the future. So I'm going to turn it over to Dr. McAvoy first.
Okay, thank you, Dr. Seplow. So hi, everyone. I'm Megan McAvoy. I'm the chair of the Academic Senate Undergraduate Council, and I'll tell you about the plans for undergraduate instruction for the fall. As I'm sure you can imagine, there have been many discussions this spring about how to safely reopen, and we've been making plans based on the current guidelines from the LA County Department of Public Health and information from the UC Office of the President. The good news is that overall, we're moving forward with plans to have the majority of our courses in person in the fall term, particularly for smaller classes. We do expect that we will still be subject to social distancing requirements, and so our classrooms are planned for 50% capacity, though there are some specialized spaces like labs and performance spaces that may be scheduled to higher capacity as long as appropriate distancing can be achieved. Classes with enrollments of more than 60 students will be held remotely. This is both because of the challenges of available classrooms with enough seats to have 50% occupancy, and also because this will free up space for classes with lower enrollments to use the larger classrooms. For classes with remote lectures that have discussion sections, a mix of in-person and remote discussion sections will likely be offered, classroom space permitting. There will be some exceptions to these plans based on particular circumstances. For example, if there are courses where mask wearing would degrade instruction and so they can't be held in person. Classes are going to be scheduled from 8 a.m. to 9 p.m. on weekdays to maximize our classroom usage. But once a class has been set up as a remote offering and students are enrolled, the class will not be converted back to an in-person offering unless all students are able to attend in person or accommodations can be provided to those still taking the classes remotely. With these plans in place that I've just described, we expect about 70 to 80% of our courses will be offered in person. So while we don't know, of course, exactly what the situation will be in the fall, we hope that these plans will allow students and instructors to prepare for a safe return with plenty of advance notice about what to expect. Class schedules will go live June 1st and will indicate the mode of instruction at that time. So if the pandemic situation in LA County worsens significantly, things may change and we will need to adapt, but I'm personally optimistic and I'm looking forward to the fall term, and I hope you are as well. So thank you, and I'll turn it over to Susan Ettner now.
Thank you so much. So hi, I'm Susan Ettner again. I'm Interim Dean of Graduate Education. So Megan gave a great summary of the academic side, and everything that she said about fall 2021 classes applies to graduate classes as well. So just to summarize one more time, the expectation is that the campus will be largely back to in-person classes in the fall, with about 70 to 80% of classes being offered in person. With rare exceptions, classes with fewer than 60 students enrolled are expected to be held on site. Those with 60 or more students enrolled are expected to be held remotely. Secondary sections or discussions will be held primarily in person. An accommodation process is still being worked out for students who are unable to take in-person classes during fall quarter due to a documented medical condition and who need courses that are offered only in person in order to make degree progress. However, the first step will almost certainly be for you to work with the Center for Accessible Education to document your disability. Also, for those of you who are concerned about your ability to get a visa on time, please consult with the Ashe Center as soon as possible. More guidance will be forthcoming as soon as we have it. Other questions that we received have to do with funding and graduation. So with regard to funding, the graduate division has already altered the formula that it uses to allocate block funding in order to take into account the anticipated delays in time to degree due to COVID-19. But it's important to realize that block funding is only one part of the total funding that programs use to support their students. So there have been ongoing discussions around the graduate student funding issues among the senior leadership. Nothing has been resolved yet. So unfortunately, I can't give you any more information at this time, but I'm sure as soon as anything does get decided, there will be communication coming as quickly as possible. In the meantime, though, students who are concerned about funding should consult with their departments. With regard to graduation, Student Affairs is organizing a celebration of graduating students that will include both undergraduates and graduates. However, please note that this is a celebration and not a graduation. I can't speak to what happens at the individual school level because there may be events offered by particular schools. And I will also not speak to the undergraduate level, but in terms of the campus-wide doctoral hooding that the graduate division sponsors, we will not be having that this year. It will be virtual. However, we are really hoping that we will be able to offer in-person hooding next fall, as early as next fall, for those who completed their doctorates during the 2019-20 and 2020-21 academic years. So no promises because it depends on what happens in the fall, but that would be our sincere hope to be able to offer that. That's it. If you have other questions that weren't addressed, please post them to the Q&A. And if they don't end up getting addressed during this town hall, we will post an FAQ later on to try to address all the questions that you have. Thank you very much.
Dr. Ettner, before you leave us, I do have one follow-up question that came back and wondering if you might know, but can PhD students advance to candidacy by doing presentations virtually this summer?
This summer, that's a good question. I don't know that we had definitively talked about that, but I will write that down and I will get back with an answer.
Excellent. So we'll respond to that in our FAQs following. Thank you. And thank you both so much for that information, and important to know. And there are some additional questions as it relates to vaccinations, and if students are not able to be vaccinated, what are their options for classes in the fall? So we will look to loop back to additional questions. Right now, we're going to move to summer and fall planning as it relates to services and activities. And we're fortunate to have Dr. Michael Morantz, who is our co-chair for the COVID-19 Response and Recovery Task Force, as well as Mick DeLuca, who is one of our assistant vice chancellors for campus life within student affairs. I believe Dr. Morantz is going to kick us off, and then we'll move to Mick. Thank you.
Thank you, Seppi. I just have a few general comments, mostly to reinforce what's been said before. Our hope is that, assuming that the numbers continue to improve and that the county allows us to, that we will be primarily returned to campus in the fall. A lot depends both on the numbers in LA County and on the numbers of students, faculty, and staff who are able to be vaccinated. So again, as John Ballard was saying, we urge anybody who can to get vaccinated, get vaccinated. It increases our ability to bring people back in a full way. And we are hoping that a majority of instruction will be able to take place in person, although as both Megan and Susan indicated, there will continue to be certain remote options for both for size reasons and also for individuals who cannot in one way or another be present in person. But the hope, as I say, is to keep moving forward so that students and faculty and staff can have a relatively normal and safer experience on campus in the fall and beyond. And with that, I'll just turn it over to Mick, who's going to talk more about certain specifics.
Thank you, Michael. As we work on all the logistics for the learning environment of campus, and you'll hear soon about the living environment, we're equally working diligently on bringing back the vibrant student and campus life of UCLA. We're in Los Angeles County, as you're all aware. We have monitored through the various tiers currently operating in the orange tier. Meet on a regular basis with LA County Department of Health. And even here in the spring of the year, as John indicated, with the numbers trending down, some sectors have opened up and we've begun a gradual return on campus even this spring. Things like Drake Stadium and Sunset Canyon Rec, swimming pools, tennis courts are now open under the restrictions. We hope to have some of the indoor facilities open even before we complete spring quarter, as the staff is working through operational plans and retraining of staff for those various facilities. That will merge itself into the summer, where as we continue to monitor the guidelines, we anticipate that activities will begin to be back on campus. Some of the campus life returning, working through all the protocols for our student organizations and being able to request activities. A focus is on the outdoors first, and then we move to the indoors. And as we move to the fall, and as you've heard in the various updates tonight, we anticipate with a reassembled campus that most of the things we enjoy at UCLA will be returned under the various guidelines and the various sector things. Things like our student service units with having offices open, hybrid activities available virtually, and accessibility almost 24/7 via email and web. Most of the building activities, as I mentioned, whether it's the Wooden Center or BFIT or KREC back in an operational standpoint, our student activities that we enjoy from sports and entertainment, we anticipate. I should mention that even this spring, under the adult and youth guidelines, some of our club sport teams, in addition to the intercollegiate teams, have returned to training. And when we get to the fall, we anticipate all those participatory activities. Intercollegiate athletics is certainly planning, and the guidelines should allow for spectators in the stands. We anticipate that many of those things that we enjoy in the fall and bring the pageantry of college life and college sports back, whether it's our marching band or spirit squad, under the various guidelines, will have returned and will be part of the atmosphere that we have. A number of questions about what it will look like on campus. And as you've heard, we will follow the LA County guidelines, and in specific, the guidelines for institutes of higher education. That could continue to remain the concept of wearing masks in public settings, some level of distancing, as you heard in the other presentations. And so we will continue to monitor and try to build a community of Bruins for Bruins, really thinking about a community of care on campus where we're all looking out for each other and taking care of ourselves. So I think I'll end with that, Suzanne, and then we can answer any other questions.
Thank you, Mick and Michael. Before we go off, Mick, I know you were recently also on a panel for our international students, and I'm wondering, we're going to see if that presentation was also recorded. But I do know that our DashU International Student Center does have a lot of resources on their website, which I'll put in the chat, the website. But any information in terms of that was shared at that town hall that could be helpful or directed to the link for students if it was recorded?
Yes, I know a lot of questions have come up, and we are very excited to welcome our international students back on campus. As you have heard, with the in-person classes and working with the DashU Center to make sure your visas are in place, I think you can look as we continue into the summer, if there are course requirements that meet that, and then understand what those course requirements are related to the fall. And as anticipated, and certainly the DashU Center is there to help you every step of the way, working very early on. We have heard there are delays in a number of countries. So getting very early on making sure your visa situation is in line for being able to enter the country, and then certainly transitioning to campus at UCLA.
Thank you, Mick, so much. So now we are going to transition to some Q&A of questions that may still be outstanding for many of you. And again, if we're not able to respond, we will work on a FAQ to be able to answer as many questions as we can have. I will share with you that information continues to evolve. You'll hear messages that continue to align us with LA County Department of Public Health. So many of our decisions continue to need to be in line with LA County Department of Public Health. And before I go to Q&A, I apologize. I did not forget, but I kept moving forward. So before we go to Q&A, I'm really pleased to have two of our housing colleagues here with us to give some overview about housing. I know that there's been a number of questions about housing and the residential experience. So before we go to those outstanding questions, I will turn it over to Pete Angelis, our Assistant Vice Chancellor for Housing and Hospitality Services, and Sarah Dundish, who is our Director of Housing Services. Thank you both for being here.
Thank you, Seppi. I should start by saying the number of beds that we'll be able to provide our students will be informed by the LA County Department of Public, will be informed by the guidance given to us by LA County Department of Public Health. The key metric we will be looking at, and I'm sure they'll be focused on, is what percentage of our students are vaccinated. So I think you've heard several times from several different speakers this evening the importance that our students arrive at campus vaccinated. And if we hit the required percentages that LACDPH will require of us, we are hopeful, I would say perhaps even confident, but definitely not certain that we'd be able to provide triple occupancy on our Hill. If we're able to do triple occupancy, we'll be able to reach the number of students that we typically are able to accommodate for first-year students, second-year students, first-year transfer students, and a very high percentage of our second-year transfer students. Again, this is all determined by whether or not we can be at triple occupancy. Our grad and family housing are not impacted as their apartment inventory, and we've not received guidance to reduce capacity in that inventory.
Thank you so much, Pete, for giving us that overview as it relates to housing, and we certainly look forward to the Hill being repopulated and campus at large being repopulated, and excited for UCLA's return. I want to thank all of our panelists thus far, and we'll now move forward as it relates to additional questions. And so first, I am going to go back to a question that's been asked as it relates to our international students. And this may be for John, it may be Mick chiming in, but should our international students get vaccinated again if they're already vaccinated in their home country? And maybe Dr. Flores might want to weigh in on this too.
I would defer to Dr. Flores on this one.
Okay, here I am. So right now, the guidance that we get from the CDC is really only involving the 3 vaccines that are currently available in the United States. However, from a policy standpoint, and this is part I'm not involved in, it seems that the university will be accepting those vaccines from other countries as fulfilling the requirement. And John, I don't know if you want to add something.
No, I think we've covered that piece.
Maybe, John, if you could, I know you mentioned that students will be able to get vaccination. So if international students need vaccination, that will be able to happen, correct?
Yes, absolutely. We're planning on that. We don't know the source of the vaccines yet, but we're hoping that we will have them at Student Health and that we'll be able to provide them upon arrival for sure.
And just a follow-up, which may include some others, maybe from our academic colleagues as well, but if there's a reason why they cannot get vaccinated, either they have an exception, will they be able to attend in-person class? Has that yet been determined?
That I don't think that's for us, actually. That's not an academic decision. So
I can tell you what the current thinking on it is that without vaccination or an approved exemption, you will not be able to attend in-person classes. The question around those who have received an exemption and approved the exemption will be able to attend class. They may just be doing much more regular testing, mask wearing, and those sorts of non-pharmaceutical interventions.
Thank you. John, if you could stay for a second, what would happen if someone tests positive on campus once we are returned back to campus? So what will occur? And that's been occurring even while we've been mostly remote and limited folks on campus.
Sure. So we have a very robust contact tracing program here that's aligned with our testing program. If somebody tests positive, the contact tracing team from Ashe will be in touch with that person, help identify close contacts of that person, place them in isolation, and assist them with whatever needs they have and guidance during that isolation period. And then we would test their close contacts as well. But that will continue just as it has for anybody who tests positive for COVID during the academic year. And there will be There will be housing set aside specifically for quarantine and isolation related to COVID as needed.
Thank you. Thank you for that. And I'm going to shift gears just a little bit. And in terms of undergraduate education, I think this might be for you, Dr. McAvoy, but will first-year students have most of their classes online, particularly as it relates to potentially the limit of number of students in any one class?
Yeah, that's a great question. So, at first glance, you might think that all the freshman classes, because they have large enrollments, would all be remote and the freshmen would not have an in-person experience. But remember that the plan is to have discussion sections that are associated with those large lecture classes. Those are planned to be in person. So we expect that even freshmen, or even those that are enrolled in large courses, will have at least some in-person experience. And remember, the plan overall is to have about 70 to 80% of classes in person. So it's likely that there are some options for all students to have an in-person experience.
If I could just add to that, I think that what Megan said is right. The other thing that I would say is that there are certain aspects of classes like labs for in the sciences or your writing classes that most of which should be in person, and that if you are an incoming first-year student, I would urge you, insofar as possible, to talk to your advisor and ask around about other smaller options that you can take that would help, move you forward, but also give you an in-person experience if you're concerned about that when you look at your schedule, that they should be able to help you with that. I mean, everybody would like to.
And if I could just make one clarification, because I know Megan said it, but it came up in the chat. So the discussion, the idea that the discussion sections would be in person is true whether or not the enrollment in the main section is under 60 or 60 and above. So that part is irrelevant. So all the discussions are expected to be primarily in person, and there may be some that get offered remotely, but that's not guaranteed.
Excellent, thank you. And while you all are on, maybe one follow-up, kind of on the reverse. If students are concerned about in-person, will they be able to take classes entirely remotely?
Well, I mean, that depends in part on what classes they're trying to take, right? Because if all your classes are above 60, and if they're offering a remote discussion, then then you could do that. If you have some reason, for example, a medical disability that prevents you from coming back in person, and you need to take classes in order to make degree progress, and you're unable to do that because they're only being offered in person, then that's when you get to the accommodations that I referenced earlier, but that process is still being worked out.
Great, thank you all for those responses. I do want to clarify just for a moment as it relates to our international students. And what I want to share is that system-wide is where we're getting guidance in terms of vaccination requirements, et cetera. And so therefore, for our international students, it has not yet been determined in terms of accepting international vaccines. So we will make sure that we're communicative with our international students around vaccination requirements, and any kind of process or procedures that need to be followed as it relates to international vaccinations and acceptance. So we will keep you posted. We will be in communication about that, and guidance will be provided system-wide. I'm going to go back to John for a moment And I'm going to ask as it relates to, we've done weekly testing for folks that are on campus for this academic year, the limited amount of essential folks that are here. But will a COVID test be required routinely? And will it be required if you've been vaccinated? And do you have any sense of how often we might need to be tested this fall?
Yes, great question, really important. It's going to depend a large part on two things: the percentage of people vaccinated on campus and the prevalence of COVID in LA County. And on campus, of course. So the idea is that we will not be doing ongoing surveillance testing of those who are vaccinated. All indications are that even if they come down with COVID, they do not get seriously ill and they do not easily spread it. So we will likely not be testing vaccinated faculty, staff, and students in the fall or during the year. Those who receive exemptions, either for religious belief or medical exemptions, will be testing throughout the year, maybe as often as twice per week. That's still being determined, but the importance is to be able to quickly identify if COVID exists and to be able to place that person in isolation for the good of the community. So we will be doing ongoing testing. The vast majority of people will be vaccinated. We will not be testing vaccinated people on a regular basis. At least that's the decision right now. That may change, as I said.
Excellent. Thank you, John. I'm now going to pivot over to Mick. And can you share a little bit about how will safe practices such as wearing masks, physical distancing, and other public safety guidelines be enforced this coming fall? And how might we avoid having our students have to monitor their peers?
Yeah, thanks, Suzanne. As I mentioned, in a community of care, we're all here to look out for each other. You can anticipate robust social media campaigns and messaging, signage on campus. And we've introduced this year, and I anticipate they will be in place as we go into the fall, what we call Bruin Public Health Ambassadors. These are student jobs on campus. It is a peer-to-peer model. It's more of a harm reduction reminder model than an enforcement mechanism. And it would, if masking is still in place, there'll be individuals to remind folks about masking. I would anticipate as facilities are open, particularly if they're access control facilities, those would be requirements to have entry. If individuals are gathering, folks will be told about distancing. And as we have in place now, we anticipate in place in the fall, there will be a reporting structure, either through the whistleblower hotline or our Dean of Students office, for individuals to report things that they believe are violation, either anonymously or with names for follow-up.
Thank you, Mick. And I will just add, within residential life and housing, we have utilized, for the limited number of students that are currently here, the resident assistants, the RAs, to be helping with kind of our public health measures, and that will continue. I'm going to now pivot back over to my housing colleagues with Pete and Sarah, and two questions I have. The first one being, do you know when housing decisions will be sent and made available, as well as a question in terms of dining? Do we anticipate our dining halls to be available for any kind of capacity for the fall, for indoor seating, and any sense of dining for the fall?
Sarah, you want to answer the question on timeline, and I'll pick up dining.
That's perfect. Hi, everybody. My name is Sarah Dundish. I work with Pete and Suzanne in housing. For timing, we're really hopeful that we'll be able to start the offer process in early July, but start engaging with students obviously much sooner than that. We'll hopefully be able to give clarity on when things are happening so you can plan reportedly and within the next couple of weeks. But we're hopeful that the offers will go out, like I said, the beginning of July, and then we'll work with you all the way up through the assignment process in August. And I'll turn it over to Pete to talk about food, which is far more exciting.
Yeah, our talented and dedicated dining team are working on a variety of operating scenarios for the fall, largely around not only the double scenario, if we have to be in that capacity requirement, but also triples, and also what scenarios we provide dining if there's certain distancing required within our dining facility. So it's rather complex, but our team is very skilled, and we're confident we'll have an effective way of providing high quality, nutritious and delicious food to our student residents once that time comes.
Excellent. Thank you both. And I apologize if this was already answered, but I'm going to just bring it forth and maybe see if it could be answered. And that is for summer session C, if things do continue to improve, is there any expectation that summer session will be in person, or is that all determined to be remote?
I can take that, unless Pete wanted to. It looked like he was about to answer. So there is the option of adding in-person classes. They have to be approved, but what we are not going to do is change classes that were already scheduled to be offered remotely. We're not going to switch those to being in person because people have already made their plans for the summer, and we don't want to tell them at this late date that they need to pivot. So any classes that end up getting that were already approved for being remote need to stay remote, but they can be augmented with additional in-person class offerings depending on approvals.
Just to follow up on Susan's point, what departments at this point can request that they add in-person classes? There won't be a lot of them, but if you're a student and you're already looking at your schedule or made commitments, the remote classes that you've taken are going to be remote, and I wouldn't think that it's likely that there's going to be a great many added in-person classes. So you should assume that it will be it'll be largely remote with some potential additions in person. In a way, it's going to be the flipped version of the fall, we hope.
Excellent. Thank you for adding those comments, and truly appreciate everyone's answering of many of the questions and providing some updates at the beginning of this town hall. I recognize, I just want to see if there's any last questions. So let me just see if we have time for one more. So maybe if I could just ask Sarah to just give a brief comment as it relates to timeline for housing applications, if we have that information.
Yeah, that's a great question and probably on top of mind for everybody. So first, as Pete kind of indicated earlier, we're still figuring out how and who's going to get the offer. But once we have those figured out and once we know kind of the capacity, what we can commit is housing is going to share with all students exactly when they need to apply by, when the deadline is, and exactly what steps they need to take to be a part of the process. So right now we haven't set the deadline for the housing application, but please know that as soon as we have that deadline, we're going to give students and families ample time to think about it and kind of figure it out, apply if that's what they decide to do, and then reach that deadline before we get to the housing offer process that we're hopeful to get to in early summer. But know that we will communicate to everybody, regardless of if they're living with us right now or if they're not, what their plans are for next year, and we'll post it on our website. So know that we will tell you what you got to do next, and you don't have to keep that in your head right now.
Great, thank you. Well, I do know that we are out of time. I want to once again thank all our panelists for the information that they've shared. And I also want to thank all of our Bruins out there who have joined us and continue to ask us questions and provide your insights and suggestions as it relates to our response and recovery from this pandemic. And so we will continue to commit to ongoing communication with our students. I know there's been a number of additional questions related to for our international students, and we will connect with our DASHU Center and make sure that we are getting you answers to your questions. Many times they're specific, and we will make sure that we are being responsive to those questions as well as to the multitude of questions that continue to come forth. So I appreciate everyone for joining us. I thank you for being present, and don't hesitate to reach out to any of our offices should you have individual questions. So I wish you all good night. Thank you for being here, and go Bruins. Thank you.